Okay, so 10 a.m. is here. Let's get started. I want to thank all of our attendees for taking time out of their schedule today to join us on this webinar. I am Joe DeLucchi with Cal Insurance, and COVID-19 has been a major discussion point these last few weeks. And as such, Cal and our key strategic work comp safety and claim management partner, ESM, who's joining us today, we've both been inundated with emails and phone calls on this subject the last few weeks. And because of the volume of inquiries, we thought it would be important to host this webinar for our clients, for our referral partners, and for our friends. So welcome to the webinar today. You're going to receive some excellent takeaway materials as well. Anthony is going to be pointing those out as the webinar goes along, and they'll also be available on the Cal website. They'll be available on the ESM Insight website as well. If you have any difficulties or trouble downloading, just let myself, Joe DeLucchi, or Anthony at ESM know, and we'll be happy to email those as well. There'll be immediate takeaways, including an exposure control plan, which will be important for all employers. And this webinar is also being recorded. So Sinead, let's go to slide 2. So in the interest of keeping our talk today moving along, everyone's on mute, but we do have at the bottom a comment button and also a Q&A button, whichever works for you. The questions will be compiled. We know that there's going to be a ton of similarity in the questions, so please type those in. They'll be compiled and then asked after the slides have concluded. The 4 elements of the presentation are listed right in front of you, and some of this, I should say, is going to touch upon employment law too. And I'm guessing the employment attorneys out there have been as busy as we have been the last few weeks in fielding these questions. If you don't have a good employment attorney that you're looking for advice from, let us know, and we'll be happy to make an appropriate connection. And then spoiler alert as well, within the slides, you're going to see an excellent decision tree for how to handle potential work comp claims, as well as feedback from 2 major work comp insurance carriers. Sinead, let's look to slide 3. So Cal decided to partner with ESM for our clients' work comp claim management and safety management needs about a year ago, and we cannot be more pleased with the partnership. Our clients who have had the need for their services have benefited greatly, and that's by a lot of comments and a lot of feedback I've personally received, highlighting and appreciating their guidance and their expertise. And so we're both referral-based organizations, so please let your fellow business leaders out there know about us. At this point, I would like to introduce our ESM partners. Anthony Poston, he is the CEO of ESM Insight. He also speaks and has a background on the risk management perspective of work comp. And then Sharon Poston is the president, and also her background is on the work comp claim management side. Sinead and Haley as well. Some or maybe many of you do know them too. They have also joined us. So with that, I'd like to turn it over to Anthony to take it away on the presentation.
Great, thanks, Joe. And we definitely appreciate the partnership. We've been able to accomplish a lot of really wonderful things for employers. And speaking of those things, here's one in particular, the exposure control plan. So before we get started, here are 5 different tools that we've developed for employers. And we're going to go through some of the exposure control plan today. And before we dive into the slides, we want to be very respectful of everyone's time. We have a pretty large attendee base today. And so we're just going to spend about 30 minutes touching on some highlights, but we put together a pretty extensive slide deck, which you'll see. We're going to be providing that to you. And then I recommend you meet with your safety committees, meet with your teams, and work through some of these processes that we've outlined, because we have a range of different industries that are on the call today. And this isn't a one-size-fits-all. So it's really meant to be a framework for you to start having discussions internally, and then use these tools for creating your policy, providing training, and then making sure that we are, one, keeping our employees safe, but also preventing the potential spread, which we've all seen in the media. It's spreading like wildfire. So first, we have our exposure control plan. It's about a 4 to 5 page policy. From that exposure plan, we've created safety training tips. They're 1-page trainings in English and Spanish. On the 2nd page, there's an attendance form for you to have the employees complete. We've also recorded this in a really brief webinar, which you'll see down there on the left. And then we've also put together this exposure control plan overview, which is the PowerPoint we're going to go through next. And then, as Joe mentioned, we have the work comp decision tree. Again, this is meant to be a framework for you to take these tools, review them internally, modify them as you need, and then start the implementation and training aspect. All right, so let's get started. So with any safety policy, what you want to do first is establish the policy. And in this case, it's going to be the exposure control plan. And within that exposure control plan, you're going to develop the policies and procedures for how you're going to manage that specific exposure. Once you finalize that, you're going to review it with the managers and supervisors. And then from there, you're going to provide training. In this case, it's the coronavirus safety training to the employees. Once you've provided that training, you obtain their signatures and you maintain those for record keeping. And this is really the formula for implementing every safety program per your injury and illness prevention program. Your IIPP has 8 elements, and this satisfies roughly 3 to 4 of those elements, depending on the implementation aspect. So we're going to go through a little bit of the exposure control plan. You're going to get a copy of all of this. And again, I recommend you review it internally with your managers, supervisors, even your employees, to really figure out how you're going to control this exposure. Sinead, why don't we move on? All right, communicable diseases. So communicable diseases really are bloodborne pathogens, aerosol transmissible diseases, and then there's other infectious diseases which are spread through various body contact or if you come in contact with infected body fluids. And this COVID-19 is considered a community spread, which means that people will be infected in an area, and some of those people, which we've seen in the media, don't even know how they've gotten infected. So there are still so many unknowns about this potential virus and how it spreads. We do know that it is spread through respiratory droplets. So when somebody coughs or sneezes and then somebody touches that, they touch their face, they absorb that virus and then they become infected. And again, it has spread so quickly that we're still unsure as to how many people are actually infected because there is an incubation process to it. And so we don't know if there's actually more people that are infected and they're spreading that virus as well. So again, lots of information that we're tracking, but we don't know a lot about what this virus is just yet. So the best thing that we can do is start to implement an exposure control plan that keeps our teams safe. And then hopefully through that safety implementation aspect, we're also going to prevent the potential spread of this virus even more so. And I think we do have some remediation companies on this call as well. And we've talked to a few of them, and we know they are very busy decontaminating various school districts, public utilities, and other just private employers. So within your organization, you probably have a safety manager, maybe it's a safety director, could be environmental safety and health manager, a safety coordinator. There's a lot of different titles for this role. But really that safety manager is going to start with developing the program. We want to make sure that it complies with Cal OSHA standards. So in this exposure control plan, as I mentioned before, there's references to the bloodborne pathogens program, as well as the aerosol transmissible diseases program. And those are 2 Cal OSHA standards. Now the ATDs is really more geared towards healthcare. It doesn't really impact the general industry, but bloodborne pathogens does. And we see OSHA reference that a lot in various inspections and audits. So when you're writing this exposure control plan, cross-reference your bloodborne pathogens program to make sure that both of those align with each other. So the safety manager is going to help define the program. We're going to develop safety tools. We're going to roll those out to the employees. We want to work with the employees on potential exposures. So as we're looking across the organization, the departments, the different facilities, the different tasks, what are those departments that could be more susceptible to an infection? So once we've defined what that program is, we're going to roll that out to the managers and supervisors. They're going to ensure that we implement the exposure control plan, that we're managing the processes, the procedures, we're training the employees on what those processes are. And then those affected employers are just going to follow suit with, here's the policies and procedures I need to work within. But also, although this is a top-down approach, we also really encourage a participatory culture where employees are providing feedback upline to managers and safety managers to say, hey, we might have a greater risk in this specific department or on this job site. We need to take extra precautions. And so working with the upline to make sure that we have some management practices in place. So this is, it's a global epidemic now, as Joe just mentioned. The World Health Organization just announced that. And so we need to work together as a community and as organizations to help minimize the exposures and minimize the continued spread. Okay, this is kind of a busy slide, but I've been getting a lot of questions about what is the process and how do we go about developing that? And so I put together this decision tree, and this is not a one size fits all, but we're going to provide these slides to you and they're all editable. So I encourage you to go with your team, review these, and then start modifying them to fit your organization. You can see we're starting with the first step of somebody, an employee, notifies the employer that they have symptoms of COVID-19. Now, is it work related? Is it not work related? What are the next steps that we take from there? And so you can see here in the bottom right corner, some additional policies that we need to review, are the work from home policy, PTO and sick policies, and also your travel policy. So sick in particular, Sharon's going to talk about this in just a few minutes about SDI and the availability of state disability insurance during sick time or if PTO is exhausted. So we'll talk a little bit more about that on the workers' comp side. But if something happens, what are the next steps? How are we going to isolate or contain or quarantine that individual? Has that individual affected the department or infected the department? And then are we going to have to decontaminate that department? What are the next steps with that within your organization? And many of you have multiple facilities, multiple job sites. So again, use this as a framework to have the discussion. And then once you can identify those processes, you can use this as a training tool to the employees. This goes deeper into control procedures. So I've listed just a few different procedures here for you. Again, in the essence of time, I don't want to go through all of the specifics, but when you have these slides, you can pull them up with your team and you can start to work through what are our transmission control procedures. Just some examples of how are we going to prevent exposures to ADTs or BPPs or OPMs, a lot of acronyms here. How are we going to ensure the safe handling of contaminated waste or regulated waste? If there is a contaminated area, we decontaminate it. What are we going to do with that contaminated waste? How are we going to dispose of that? What are some personal hygiene practices that we can implement at our organization to help prevent the spread? What PPE do we need in order to prevent employees from being impacted? And respirators are a really big question right now. Are we implementing respirators? Do we provide respirators? If we provide respirators, do we have to comply with the respiratory protection standard of Cal OSHA, which is pretty extensive? So I'll talk more about that in just a second. And then if we're cleaning and decontaminating work areas, what are we going to do with that regulated waste? So Sinead, why don't you take us to the next slide here? So PPE. So while I was touching on respirators, right now the CDC recommends that employees or the general public that is not infected, they do not have to wear respirators. And so one of the questions we've been getting from various employers is, what if my employee or my coworker is coughing or sneezing? Do I give them a respirator? What are the requirements that I have to comply with if I provide them with respirators? Second of all, it's really hard to get respirators right now. Amazon is sold out. A lot of the different PPE manufacturers are sold out. So it's really difficult to get those. And oddly enough, toilet paper and paper towels. So everybody's stocking up like it's Armageddon, which is, again, I think accelerating the fear factor of all of this. So all the more reason that it's important that we have a plan so that we can control the variables that we have control over. So personal protective equipment policy, do you have one? And Cal OSHA wants to see employers, they actually require employers to look across the organization at all of the different tasks and the exposures. Once you've identified the tasks as they relate to the exposures, or the exposures as they relate to the tasks, then you want to identify what personal protective equipment is required for those specific roles. Now that then rolls into your PPE policy. Do we have to wear gloves? Do we have to wear safety glasses or goggles? As I mentioned, respirators, rubber boots, aprons. So then we look into our bloodborne pathogens program and what PPE have we defined that we require for our organization if there is a blood spill? What are the chances of a blood spill? Lacerations, cuts, other machinery that can create a much larger exposure. What are we doing to manage that potential exposure from a PPE standpoint? And then, as I mentioned, the Respiratory Protection Program, Title 8, California Code of Regulations 5144. It's a pretty extensive standard. So if you are requiring employees to wear a respirator, One, you have to identify what is the reason for the respirator. What are the exposures? What is the particulate in the air that requires a respirator? And then we have to go through the medical evaluation of those employees. Are they fit to wear a respirator? Do they have any respiratory issues that could be aggravated by wearing a respirator? And then finally, fit testing and training, and then just maintaining those respirators. So it's pretty extensive. So if you do not require respirators, don't feel that you need to go out and get them. Again, this goes back to the decision tree on if somebody is sick, what are we going to do as a next step? So have that discussion with your team. Use that decision tree as your framework for that dialogue. Decontamination procedures. Again, this is going to be something you'll need to discuss internally with your team. If we have an infected department, what are we going to do to decontaminate that? What notices do we need to send out to our employees? What's the time frame? Who are we going to call to decontaminate it? Do we need to have a specialist come in to decontaminate it? Those are all questions that you'll need to answer based on your organization's exposures. And then what do those procedures include? From how are we going to clean the material, and then how are we going to dispose of that once we have that contaminated personal protective equipment or that contaminated waste. So again, this is a framework for you to have this dialogue with your team, and you can use these slides for discussion points. So we've given you some ideas on what to do, but again, you need to go through and identify what your process is for your organization so that you can implement practices that are relevant. Regulated waste. So I've mentioned this a few times. This is the definition of regulated waste, and it consists of just contaminated items such as liquid blood, other materials that might release some of the exposure, contaminated sharps, pathological or microbiological wastes. Some of these words are mouthfuls. So if you have regulated waste or contaminated waste from a decontamination process, what is the next step to dispose of that? Which leads us to the next slide here, Sinead. Do you have waste containers within your facility? I'm working with a janitorial company that works with hotels, cleaning the various kitchens and rooms and so forth. And there are a lot of times blood spills from guests. So the janitors are cleaning this up, and we have reached out to every hotel, major hotels, to ensure that we have contaminated waste containers so that we can dispose of that properly. And it has been a battle to get them to provide those containers. So what the janitors have been doing they've been cleaning it, documenting it, putting it in a red bag, and then leaving it next to the trash bins. And then we're pushing the hotels to make sure that they dispose of that properly. So making sure that those waste containers, one, are self-closing. They have the biohazard sign on it so we can recognize that that is something that contains contaminated waste. So if you go to the next slide, one of the exercises that I'd like you to do is identify if you do need these containers, and if they are, where are they located? And if you do have them, ask your employees if they know where they are and what the procedures are if there is a blood spill. So again, going back to your bloodborne pathogen program, as it relates to this exposure control plan, have those discussions with your organization. Do we need these biohazard containers? If we do, where are they positioned? And then what's the process if we clean up and have this contaminated waste? How are we going to dispose of that? And one solution would be to call your medical provider or your industrial clinic, because they'll have procedures for disposing of that. And so you can contact them and ask them if you're able to drop that off, and then they can dispose of it for you. General health and hygiene tips. So there is a lot of information on the CDC. I recommend you as an organization review it. We provide the resources for that. And then from that, you can develop health and hygiene tips as a safety training for your organization. Put your logo on some letterhead, or put the safety tips on your letterhead, and then roll that out to the employees. And really what I hear most from all different types of medical specialists, wash your hands. And that is pretty much the first and foremost thing that you can do to prevent the spread, one, to yourself, and then second, to others. So washing your hands, I'm hearing up to 40 to 60 seconds. There's a funny meme going around about what songs you should sing while you're washing your hands, because that in turn provides about a 40-second interlude for you to complete the process. So the CDC is continually recommending new hygiene, health and hygiene tips. We provided the link, as you'll see here in the coming slide. I recommend you watch those and then continue to provide that training to your employees so that they are aware of what they can do to prevent the exposure. Here's some additional CDC preventative measures. Voluntary home isolation. So as I mentioned, review your work from home policy. Do you have one? Are you able to have one? You know, service industries, laboring industries, it's going to be a little harder for that. What's the respiratory etiquette? Hand hygiene, as I mentioned, washing your hands. Evaluating international travel requirements or even just general travel requirements. We're seeing a lot of airlines right now reducing their rates and also providing no-cost transfers. So if you are traveling for business, ask yourself if it's necessary at this point. And although we don't want to send our country into a recession by not traveling and continuing our businesses, you need to evaluate whether or not you're going to be putting your employees at a greater risk by having them travel to specific areas that might have a more higher aptitude for infection. And then just to increase community resilience, review your exposure control plan, have a readiness response program if there is a further outbreak. And then also, what are the processes for you internally to manage the potential for the exposure? How are you preventing it? And then also, how are you going to mitigate it if it does become an exposure within your organization? Okay, I'm going to turn this over to Sharon. She's going to talk about coronavirus as it's covered under workers' comp. This is a pretty common set of questions that we get from employers right now.
Thanks, Anthony. I know we're all doing what we can personally and as businesses to prevent the potential spread of COVID-19. But the big question is, will a claim be compensable under workers' compensation? And the answer is, it's really a case-by-case determination. In order for a claim to be compensable under workers' comp, it must satisfy the two-pronged test for AOE-COE. That means the claim must both arise out of employment and occur in the course of employment to be covered under workers' comp. So the facts of each case will have to be investigated to determine if AOE-COE is satisfied. The Labor Code does have a provision for occupational illness, but like the common cold or flu, the coronavirus would be considered non-occupational unless the employee can provide medical evidence of a causal connection between employment and the disease. An example would be a healthcare worker or a doctor, nurses who are working directly with infected patients, or maybe even teachers who are exposed to infected students. Next slide. What are the workers' comp carriers saying? Well, the ones that I've been talking to are saying pretty much the same thing. Prevention is paramount, but if a claim is reported, it will be considered on its own merits. The facts of each case will be evaluated to determine compensability. Next slide. What are the work comp attorneys saying? I mean, because I'm getting lots of emails from various law firms, and really it's just the same message that we are getting. Is the causation a reasonable medical probability? One of the questions that we would always ask is there an increased risk to your employee or to this claimant compared to the general public? With an up to 2-week incubation period, it will be very difficult to prove that an employee contracted the virus at work, even if another employee tests positive with the virus. There's a law firm, Michael Sullivan, he published a blog yesterday and said, he quoted the 1998 Laurette case that said, just catching the disease at work will not be enough in and of itself to establish compensability. So as you're hearing repeatedly, we don't know exactly what the outcomes are going to be. What we're talking about today is workers' compensation. Oh, so I think we missed the slide. Did we? Oh no, we put them in a different order. Okay, got it here, thank you. But we acknowledge that as an employer, you have many more areas of exposure. We recommend that you discuss these questions and policies within your organization, and then, as Joe mentioned, with an employment law attorney to make sure that you are establishing policies that can be effectively utilized throughout your organization. Next slide. So, whoops, I think I missed one, but we're all right. As Anthony explained, prevention is the best method of control of the virus. But in spite of all that you do to create a clean and healthy environment, what if an employee lets you know that they have contracted COVID-19 and they think they got it at work, and they want to file a claim. What do? Well, first you give them the employee claim form and submit the claim to your carrier or third-party administrator. If you usually call in your workers' comp claims, usually the intake operator will ask you something like, do you question this injury? Or maybe they will say, do you dispute this injury? And your answer right then is yes. And then you state that you would like the claim delayed and investigated. This will ensure that the claim is assigned to an indemnity claims adjuster to conduct an investigation, and that it doesn't get stuck on a medical-only clerk's desk and miss the opportunity to investigate to determine if there is compensability. If your employee has notified you that they want to file a claim or that they think their illness is work-related, then you have knowledge. And from the date of your knowledge, the carrier has 90 days to conduct their investigation, and they must issue an acceptance or a denial by the 90th day. So I encourage you to follow up regularly with the assigned adjuster during the discovery period, maybe even weekly or biweekly, until a decision is reached, accepted or denied. Meanwhile, stay in touch with your employee. Regardless if the claim is considered compensable under workers' comp, you will maintain the care and concern of your employee as the employer and discuss scheduling for targeted return to work dates and so on. For California employees, you can direct them to apply for state disability if they're off work while they're waiting for a decision on the workers' comp coverage. Next slide. All right, what if my employee contracts the coronavirus, the COVID-19, and then transmits it to his family? Well, the first step, we will again determine if the employee satisfies the AOE-COE rule. If the claim is considered work-related, then there may be coverage for family members under Coverage B or the employer's liability section of the workers' comp policy. This is an uncommonly used coverage. I've only seen 1 or 2 cases in my many years in workers' comp, but these seem to be uncommon times. So it's good to know that there may be potential coverage for family members under your workers' comp policy. As you can see, the answers are not black and white. I think we all want to have a line drawn in the sand so that we can feel in control about what happens, but instead there are many uncertainties. But I encourage you to keep asking questions, keep the communication open with your employees. I think it's important for you to let them know of the steps you're taking to keep them safe, and hopefully that will relieve some of the anxiety that they may be feeling. If you initiate these processes and programs that Anthony has just discussed, make sure that you let all the employees know what you're doing and how you are trying to care for them. Yesterday, I had another law firm, Mullen & Phillippe, send out an email that said, stay calm and wash your hands. So I'll leave you with that good advice. I encourage you to stay calm, to act in good faith in these uncertain times. Anthony?
Yeah, so before I kind of close out here and throw it back to Joe, one of the questions that came up that I saw in the chat window was, what if my employee is experiencing flu-like symptoms? What do I do? And there is no specific answer other than I've heard multiple employers saying if you are experiencing flu-like symptoms to stay at home. I've had another employer say we're going to provide the employee with a respirator, but given the fear factor and the just the general exposure and the media sensationalizing this, there's a big fear factor within just the general community. If I provide somebody with a respirator, does that mean they're sick? I was on a flight just a few weeks ago, and when I got on the flight, there was about 10 people that had respirators on. And that was obviously a concern to me because are they sick or is it preventative? Those are things that we just don't know. So I encourage you to discuss these internally about what your processes are. If you need to discuss with an employment law attorney, you can reach out to Joe. He mentioned several that he works with. I'll open that up to the other panelists that are on the call. I know that you're probably fielding some of these same questions, and that's probably the biggest one that we're getting. What do we do if an employee is experiencing flu-like symptoms? What is our process? Joe, Sharon, do you have any comments on that?
I think it just has to be case-by-case basis. It's very difficult if you send an employee home. Is it with pay, without pay? Are they entitled to sick time? Is there other PTO that they can apply for? It's going to be a very difficult situation. And Do they have health coverage? Can they go to their doctor to be tested? I think we are seeing the availability of more testing now that we did not have in the past, so that will be a good factor as well.
So I would encourage you to use that decision tree, as Sharon mentioned, and create a decision tree process for this and work with your team. Joe, I know you had something.
Yes, I was just going to say that we had, as an organization, or I had sent out a memo to all staff about 2 weeks ago. We have the ability to work remotely, but I understand that not all businesses do have that ability. To the extent it is available, certainly we're encouraging that for any staff that is under the weather, certainly not feeling well. We don't want them here. We want them to get healthy, to work remote to the extent that it's possible for them as well. But obviously, we don't want anybody, bringing anything contagious into the workforce.
So we'll close out, before I give it back to Joe, just some additional company policies to review. Bloodborne pathogens, health and hygiene. It's not necessarily a Cal OSHA requirement, but consider having a health and hygiene program. Just as we discussed, what is our process if somebody is experiencing flu-like symptoms? So that health and hygiene policy could address some of that. Your PPE policy, personal protective equipment, work from home policy, as Joe just mentioned, and then your travel policy. These are all items that you should discuss internally and maybe be a little more flexible during these times if you have the ability to do so. But again, using that decision tree as just a framework, and you can apply that to each one of these different policies. So Joe, we are right up on 30 minutes. There was a lot of information that we provided to everybody. Again, this is a framework, and if you have specific questions that you want more of a one-on-one consultation, please feel free to reach out to us and we can collaborate with you on what some of those processes are.
Thank you for sharing the resources here. Again, because I know a couple people came in late to this webinar. This has been recorded. We are sending out the slides as well. Within that, you're going to get that employee workers' comp decision tree and the other documents that have been discussed as well, the exposure control plan. Anthony, I know there were a couple of questions that on the Q&A kind of relate to that as far as sign-offs to the safety checklist that's been shown. I don't know if we want to take a moment just to identify those questions. I know there's another one about SDI covering time loss, Sharon, on there as well, and clarity on the N95 respirators too.
I'll address the N95. So OSHA's stance, and I've talked to a few different OSHA consultation folks about the N95, and there is a lot of flexibility in this right now. So for those of you that don't know, N95 is a basic dust mask. It is considered a respirator in just general use if we were to exclude the coronavirus exposure. A lot of N95s have that little filtering piece in it as well, and then you move into the larger respirators that are cartridge focused. So if you have a respiratory program and employees require a respirator based on the exposure, obviously you need the respirator program, medical evaluation and fit test. For those employees right now that want to wear a respirator, I would first ensure that you have no knowledge that the environment contains the exposure, but this might just be a personal best practice that the employee wants to have a respirator. So again, I would consider what the exposures are and then discuss with your employees on the utilization of the N95 respirator. So, there's no perfect answer. I would evaluate the exposures, discuss with your team what the expectations are, and then during this time, again, OSHA is flexible with these dust mask respirators. So don't feel that you are not going to be in compliance given the unusual circumstance we're in.
Another question, Anthony, here is just around the training for the managers. One of the organizations saying that they're having mandatory training tomorrow, and of course it was noted that we want best practices says to have the employees sign off on the safety tip material there. If they're working from home and it's going to be online and remote, I would personally think it's sufficient that the names of the attendees are just simply recorded. Is there anything further? I mean, do they need to email back that they were a part of it or anything more formal than that?
Well, if you're using online training tool like GoToMeeting or Zoom like we're doing right now, we know who's attended. So you can take a screenshot of that, you can export that, and you can see that they were actually in attendance. So you can use that as your form of compliance. Now, this coronavirus safety training, there isn't really a Cal OSHA requirement for it unless you're in the healthcare space. So we're really leveraging best practices here. So you're going above and beyond what the minimum OSHA standards are. So if you're providing that training, again, it affects employees not only at the workplace but at home. So it's a best practice, and providing more information to these employees so they can mitigate the exposure is ideal.
Right. And then another question is around SDI covering time lost from work for employees that are sent home.
Yes, well, during the period of dispute, when a workers' comp claim has been filed in particularly, or if it is non-compensable to begin with, if no one's alleging it to be work-related, they could be eligible for state disability. There is a 7-day waiting period, and state disability is we all pay into our own account. So it would have to depend on that particular employee and how much money was in their account. If they've used SDI for some other illness in the past and they're low on funds, there are some moving targets there, but what they can do is apply. It falls under the Employment Development Department, EDD umbrella, state disability. They apply, and then it will be determined if they're eligible or not.
Thank you. And then another question was, let's see, it says, sounds like for workers' comp, there's no extra liability if we don't mandatorily close the office, as people need to prove that they got sick at work. Yeah, I don't think that there's extra liability. This is Joe speaking on this. I think really it's arising out of the course of employment that was discussed earlier in the screen. If you are in the healthcare profession, if you are in disaster recovery, virus cleanup, those types of organizations where the employees are being sent in. But I think just for office exposure itself, and I don't know if Anthony or Sharon have a different opinion to this, but I think it's just by case, and up to the employer to decide whether or not they want to shut the office down, have everybody work remote. I know a number of employers have done that, but I know a number of employers are continuing business as usual.
Yes, I agree. And I think anything that you can document that shows that you have taken steps over and above to help maintain a clean and safe environment. If you don't close the office down, you do keep it open, and you give this kind of instruction and training to your employees of how to behave among other employees, coworkers, and so on, that I think will go a long way if something comes of this. Again, I don't know what will come of it. All kinds of allegations can occur, as we've seen things happen.
Right.
But the more documentation you have of the steps that you have taken to ensure a clean and safe work environment, that will be to your advantage.
Well, it goes back to if you put an employee in an environment where they have a greater risk to contracting it, as Joe mentioned, those specific industries where they are on the front lines of addressing some of the decontamination process. But going into a general work environment, are employees at a greater risk by going in there, unless it's deemed somebody was infected and they were coughing and sneezing all over their workstation.
Right. And then also on the Cal website, I'll verify to be sure it's up there, but I'm pretty sure within our blog, it contains a sample letter that I put together, or I sent out, I should say, to Cal employees covering this as well. So there is a sample document. If it's not there, I will make sure it's up there before the next hour's up. And then also a final one is, are there any litigation concerns if a company doesn't offer a work from home option and an employee or employees are sick? I don't think there is around a company just not being able to have a work from home option. There's certain industries, there's certain businesses that just can't possibly, if you're a restaurant, for example, there's not going to be a work from home option for you. So I don't know if Sharon or Anthony, if you've got a different opinion to that.
No, I agree. I agree with you, Joe. I think it has to be, you have to look at the nature of your business, establish what your policy is, how you can continue to operate as a business within that policy.
I'd also recommend just bringing that up with an employment law attorney too, just to make sure that the policy that you establish is going to minimize any potential litigation exposure.
And then the last question before we come to a close here: are there any extra steps I should take to comply with ADA, FEHA, HIPAA if one of my employees is infected with the coronavirus?
I feel like we're going to direct you back to the employment law attorney. We have expertise in the arena of workers' compensation, but when you get into the alphabet soup of leave laws, all the FMLA, FEHA, ADA, and so on, that's another world. And so I think that, I hate to defer, but we need to have that addressed by an employment law attorney.
All right.
Perhaps,
Okay, well, Anthony.
I was going to say, perhaps that's a follow-up webinar we can do as well. We can bring in some of our specialists to discuss those specific concerns.
It's a great idea. I want to thank everybody for their attendance here today. As again mentioned, this has been recorded. We will send out the slides. I encourage you to check out Cal's website and blog for course material. ESM also on the esminsight.com. We'll have that same. Thank you again for your participation. Thank you to our partner, our key strategic partner, ESM, to Sharon and Anthony for joining us on this call and webinar today.